everyone. I'm going to do a quick overview of some of the elements of schizophrenia. There is a lot of terminology related to schizophrenia in terms of how we cluster the symptoms, how we cluster the subtypes, and then there's also a lot of disorders that are schizo something that are not true schizophrenia. So I'm going to do a quick compare and contrast of all that to try to help clarify that a little bit. So first and foremost, when we're talking about schizophrenia, we categorize symptoms. So positive symptoms are symptoms where something extra is present, positive, present. Highly exaggerated ideas, perceptions, actions. This can be hallucinations, and those hallucinations can be any of your senses. It can be auditory, things that they're hearing, visual, things that they're seeing. Some people will smell things that aren't there. And then a common one is sensations on the skin, right? That feeling of bugs crawling on them or something. So any of the five senses are fair game for hallucinations. The difference between a hallucination and a delusion is a thought. It is an unrealistic, bizarre belief. And there are a bunch of different categories of delusions. I'm not going to go through all of those because your textbook does do a great job of breaking all those down and explaining them. Other positive symptoms can be movements, and then confused or disorganized thoughts or speech. The next category of symptoms are negative symptoms. And to keep this straight, just remember negative, we do the little minus sign. Negative means subtracted. There's something we would expect to see that's not there. Common ones are a lack of pleasure or enjoyment, which we call anhedonia, decreased speech, which is alogia, a lack of socialization or withdrawing, a flattening, which is a term we use for if the voice and the face don't show any emotion. So all the conversations are just flat with no emotion. A lack of basic self-care, stopping to shower, brush teeth, get themselves food, drink enough water, things of that nature. A loss of goals, which is called abolition. Now, one thing to note about this, and if you paid attention during the mood disorders chapter, this can look a lot like a depressive episode. So if somebody has a form of schizophrenia that begins with a lot of negative symptoms, at the beginning, it can be hard to separate that out from a depressive episode. That's why there's a lot of other symptoms that we can look at if you look at the diagnosis of schizophrenia. And the last category is disorganized symptoms. Disorganized symptoms are marked by a derailment and incoherence of speech, right? You're talking to them and the conversation is just all over the place. Disorganized behaviors, disorganized attention, having a hard time following a train of thought or holding their attention, expressing inappropriate emotions for what they're trying to convey. So they're very sad or they're very scared, but they're laughing, right? The emotions expressed are disorganized. It's an inappropriate expression of emotion. And disorganized thought, like them reporting that they can't even keep their own thoughts straight. Now, there's two ways that this tends to express. For some people, this can actually look very silly and childlike. But for other people, this can actually become more aggressive and violent. So now we're going to get into the subtypes of schizophrenia. I will stop this video here and pick up with video 2 so that this doesn't get too long.